For all the latest updates, subscribe to News 9.
Two different studies published by two different sources are urging people to be more careful regarding coronavirus. First, a study published by researchers from Yangzhou University in China has found flushing urinals can release clouds of virus-containing aerosols. The study sounded an alarm, claiming that inhaling clouds of virus-containing aerosols during the pandemic could be concerning. Earlier, a study reported similar findings with flushing public toilets, and that was why they were induced to examine urinals. According to the study, more than 57% of the particles have traveled away from the urinal, and it traveled at an alarming speed. In order to track the movement of virus-containing particles, the researchers used computer simulations. The particle can reach 0.84 meters, which is about the height of a man's thigh, in 5.5 seconds when compared with the diffusion performance of the toilet-induced spray that reaches around 0.93 meters in 35 seconds. To do this, we used a method of computational fluid dynamics to model the particle movement that occurs with the act of flushing. Similar to the flushing of the toilet, the flushing process of the urinal involves significant interactions between the gas and the liquid interfaces. It means that besides the toilet, the male-oriented urinal, which is a common facility in the male public restroom, could become another dangerous item. The speed at which the particles can travel poses a serious challenge to public health. Usually, while using a restroom, social distancing isn't a concern, but the recent study has raised some concern. The researchers also suggested people wear masks in public restrooms during the pandemic. Meanwhile, in a separate study, researchers have highlighted another major concern. The study points out that high humidity can extend the lifespan of medium-sized virus-laden aerosol droplets by as much as 23 times. Researchers stated that only way to negate the spread of the virus is by maintaining social distance. If the virus load associated with the droplets is proportional to the volume, almost 70% of the virus would be deposited on the ground during a cough. Maintaining physical distancing would significantly remediate the spread of this disease through reducing the deposition of droplets onto people and by reducing the probability of inhalation of aerosols near the infectious source. Often, there has been a debate of whether coronavirus can spread through the air, or in other words, is the deadly contagion airborne? But researchers have observed that COVID-19 is not just spreading through natural respiratory activities like breathing and coughing. There have been several cases reported where the COVID-19 can be seen transferring through the air. If that is the case, then high humidity could lead to a significant rise in the number of cases of the pandemic.